Dr. Stein, I've heard that when a person does an implant, or when a person loses a tooth, then the bones start shrinking and the whole arch starts shrinking. Is that true, and can you shed some light on that?
Yes, there is a layer of bone, the alveolar bone, that is there for the tooth, and when the tooth is lost, that bone does shrink, and it can affect the adjoining teeth as well. So it is important if a tooth is lost to replace it, and not to leave the space behind. Whether it's and there are different ways of replacing a tooth, but it is important not to leave spaces behind. So you do want to replace.
So if you have, for instance, if you put in on a whole mouth where all the teeth are missing, if you put in a denture, apparently the teeth are still continue to shrink, versus if you put in implants, because you put that metal rod all the way down around, or in many places at least around the mouth, that kind of replaces the root of the original tooth, at least the body thinks so, and thus the bones are not shrinking. Is that so?
Yes, that's true. In fact, with implants today, bone can be built up where bone has been lost, and it's actually it's actually easy to build bone up. It's easier to build bone with an implant than with a natural tooth. So it's and it does help preserve the bone and even build upwards, whereas a denture does cause deterioration of bone over time, which is why dentures have to be relined, because to replace the bone that's been lost, usually every few years. And implants will last for many years, and the bone has proven to last for a long time.
Right, and so even if a denture is relined every few years, isn't that the reason why our grandmoms, where there was no implants available, why they kind of looked a little caved in and like a dried out tomato and basically older than they were? Does a shrinking of bonage have something to do with looking older than you are?
Yes, absolutely. Loss of teeth does make a person look older, and the shrinkage when a person takes out a person that has no teeth, if they remove the denture, the face looks very sunken in. It has a sunken in appearance, which is what a denture doesn't just replace the teeth. It builds. You bulk it up so that it's like a filler. There's a lot of filler material that's put in so that it gives the appearance back of not having that sunken in feeling or appearance. So dentures are super.
Is it actually from what I hear, no matter what, on a denture you get a shrinking feeling, and you get a shrunken and sunken in feeling, or like a coming forward or coming back, whichever way, and where it's unavoidable, where yet with implant it doesn't happen. So basically, a person who wears 20 years denture and 20 years implants, will the person with 20 years denture, no matter what, look older compared to what he normally looks, versus if he would be wearing or have got an implant?
Yes, yes. A person that does wear dentures does look older. It does make a person look older, and implants preserves the bone so that it's as if the teeth are there, and it gives a more natural and a younger appearance.
Well, it looks to me, if it would be me, I would be starting to saving up as fast as I can money to get the implants if I have to. Which brings me to a question. If a person today doesn't have money for an implant or for several implants and needs to take other solutions, or let's say the dentures, if it's that drastic, if he has neglected his teeth that long, because if he wouldn't have neglected it, these days I don't think he ever would need denture. You could fix it way before. Am I mistaken there?
No, you're correct. Yes.
Okay. So a person who nevertheless is confronted by you, implant denture, and the bill will with no doubt be a difference, a fair difference, and he doesn't have it for the implant. Would it be okay for him or advisable for him to say, okay, go for the denture because you need a mouth tomorrow, you need to bite, you need to look presentable tomorrow. Let's get denture and then start saving up. And within a year, 2 or 3, you will have the money for the implant. Just put it, make that as important as your rent and as important as your electricity, and you will have the money, and then you can get it, and you're still preserving the rest of the 20, 30, 40 years you're living, a normal look rather than becoming a dried out tomato.
Yes, I would recommend, I think it is a worthwhile investment, and we would like to place the implants sooner rather than later. The more time that goes by, the more bone deterioration is, but everybody's finances are different, and we try, but the sooner that it can be done, the better it is, the better result, and the less the bone deterioration would be. But if a person really can't do it, then we have to wait a few years, and we may have to do bone grafts to build the bone, build upwards, to try to restore the bone. But it is an investment. It's worth it. It's worth it
to pull out all the stops right away and get those implants, or at least to put the gas pedal on saving up money for it as fast as possible, because after all, I mean, whether it's a guy like you and me, whether we're 30, 40, or 60, or whether it's girls, I don't think any one of us, especially these days, wants to look older than we are. We don't mind getting a couple wrinkles our age, so to say. We're okay with that, especially as guys. But to look older, and if you realize that the teeth are making you look older, I mean, that just sounds reasonable if it can be avoided, right?
Right. Yes.
Okay.
Yeah, I would.
You were saying something. I was interrupting you.
No. I think I agree with you. I do think it is a worthwhile investment, and we all try to do what we can to both to preserve appearance and function, and the implants serve both. It makes the food. It lets a person eat normally and have that feeling of having their own teeth, and also preserves their appearances. So it's something that we should strive to do. We should strive to keep our teeth, but if that can't be, then the next step would be to do implants to try to preserve or to restore the teeth to make them as close to natural as possible.
Right. So, here we have it. The dentist, the beautician, the dentist, the plastic surgeon, the dentist, the alternative to Botox. I love it. Bye-bye, Dr. Stein.
Okay, bye now.